There's this naughty yet pretty girl named Adha.
Aloha! My name is Adha.
During her school holiday, she decided to go for a swim at the waterfall nearby her house.
Let's go for a swim!
She excitedly went into the water without hesitation. Unfortunately, she accidentally cut herself when she was swimming. However, she ignored her small wound cut and continued to swim afterwards. Naughty Adha. The next few days after she went back home, Adha felt really unwell. She got fever, her stomach is in pain, and her eyes became red and watery. She was unable to go to the school to meet her friends for a week. Poor Adha. After resting and taking medicine from the clinic, she finally felt better. However, not so long after she felt better, such a bad thing happened to Adha. She got her fever back, her stomach was again really painful, her eyes became awfully red, and her previously beautiful and clean skin became full of rashes. She can barely breathe and she coughed out blood. Adha ended up hospitalized under the care of an experienced doctor named Dr. G. Apparently, after explaining her symptoms and her recent swimming activity in the waterfall, Dr. G suspected that she might be infected with leptospirosis. Dr. G then asked her permission to do further tests to confirm his diagnosis.
Leptospirosis is a bacterial disease that is caused by spirochete bacterium from Leptospira genus. The pathogenic strain belongs to the corkscrew-shaped Leptospira interrogans species, which is subdivided into more than 200 serovalve with 25 serogroups. In Malaysia, this disease is called as rat urine disease, since it is most often transmitted by contact with rat urine. The first leptospirosis case in Malaysia was discovered by Fletcher early in 1925. Throughout the years, the number of reported leptospirosis cases keep increasing. After 3 to 10 days of infection by the pathogenic bacteria, the first stage of signs and symptoms, which is also called as warning signs, will start to develop. These signs are high fever, abdominal pain, red and watery eyes, chills, muscle ache, rashes on the skin, headache, vomiting and diarrhea. The first stage signs and symptoms usually resolve within 5 to 7 days in most of the cases. However, in about 10% of leptospirosis cases, it can progress to a more severe stage. The first stage signs and symptoms will reappear and leads to the second stage signs and symptoms such as jaundice, coughing blood, shortness of breath, and swollen ankle. At this point, the patient should be hospitalized and be given intensive medical care. Without an intensive treatment from the health expert, leptospirosis may worsen and lead to an even more severe damage to kidney. The bacteria itself also travel to the brain, causes meningitis. It may also cause respiratory disease and even lead to death. Of transmission. The infection of leptospirosis can be directly transmitted from the infected animals through the open wound in the skin. This is because leptospirosis bacteria can gain the entry through the mucous membrane of eye, nose, and mouth. Secondly, leptospirosis can also be transmitted indirectly through contact with urine of the infected animals, or through contact with a urine-contaminated environment such as soil, water, and plants. Lastly, human-to-human transmission is also possible, but occurrence are very rare. The risk factor of being infected by leptospirosis including occupational exposure, likewise rice field workers, sewer workers, recreational activities such as cave exploration, trail biking in humid area, household exposure, for instance, house with rainwater catchment system, infected rodent, house pets such as dog. Generally, there are few ways and steps to diagnose leptospirosis. First of all, the doctor will investigate the clinical appearance of the patient. When the clinical description is suggesting the leptospirosis disease, further rapid lab tests are required to be carried out. Lastly, if there is a positive result for the rapid test such as ELISA, further lab tests should be performed. These confirmatory tests including MAT, which stand for Miller Analogy Test, polymerase chain reaction or PCR, and culture of leptospirosis bacteria from the patient sample. Fortunately, this disease is treatable by taking antibiotics such as ampicillin, penicillin, and doxycycline, and make sure the patient has to finish their prescription. For complicated cases in which the patient have developed more severe infections, they need to be treated with supportive medical care or ICU. Intensive treatment that they may receive such as intravenous fluid, dialysis to treat patient with kidney damage, ventilator for patient with respiratory difficulties, and also antibiotics that is injected into the patient's bloodstream. As it is said, prevention is always better than cure. Some of the preventive ways are controlling the population of rodents such as rat so that the source of infection can be reduced, avoiding contact with environments such as lakes, rivers, forests, caves that is suspected of leptospirosis contamination is also one way to prevent leptospirosis occurrence. For people with high risk of leptospirosis infection, such as soldiers in jungles, administrating antibiotics which they can take throughout their stay is also one of the options of Prevention Act. What else do you think needs to be done? Besides the prevention method, we suggest that time-to-time reminder might be necessary in order to ensure that people take precaution to prevent occurrence of leptospirosis. This can be achieved by steps such as advertisement or in-use broadcast, especially before period of seasonal catastrophes such as flood, where cases of leptospirosis often rise up, instead of after the outbreak. Ministry of authorities bodies in concern need to do regular checking at recreational parks. Whereas looking at the diagnosis method in Malaysia, the current method of diagnosis present in Malaysia are quite admirable. There are many diagnosis methods available. The rapid test is the most preferred way to diagnose leptospirosis as it takes less time.